As many as 3 out of 4 women and people with vaginas will experience at least one vaginal yeast infection in their lifetime. Almost half will experience 2 or more. Today, I'm going to explain what vaginal yeast infections are, discuss common causes and symptoms, and explain diagnosis, treatment, and prevention. What is a yeast infection? Yeast are fungus that normally exist on skin mucous membranes and in the vagina. When yeast growth increases in the vagina, it can cause bothersome symptoms of a yeast infection, also known as vulvovaginal candidiasis. What causes a yeast infection? The fungus, Candida albicans, is responsible for 85 to 90% of vaginal yeast infections. Excessive growth of this fungus occurs most commonly in warm and humid conditions or where skin is damaged. Although yeast is normally present in the vagina, when the normal healthy bacteria called lactobacillus decreases, yeast growth increases and can cause the infection. Other factors also increase a person's risk of yeast infections include antibiotic use, pregnancy, a weakened immune system, and diabetes. What are symptoms of yeast infection? The most common symptoms are increased white vaginal discharge, itching and redness or rash, vaginal soreness, vulvar burning and irritation, and pain with intercourse may also be present. Although nearly half of people with vaginas will have 2 or more yeast infections in their lifetime, a small number will develop recurrent yeast infections with more than 4 in 1 year. In these cases, burning is the most prominent symptom of the infection. How is someone diagnosed with a yeast infection? Your healthcare provider will take your medical history and do a physical exam. Redness and swelling of the vulva or vagina and whitish discharge are often seen with yeast infection. Your provider may examine the vaginal discharge under a microscope to see if the yeast are present. How is a yeast infection treated? Vaginal yeast infections can be easily treated with either a cream or a pill. The antifungal creams are available without a prescription and are placed in the vagina with an inserter. You can also place cream outside the vagina on the vulva to treat itching. If you continue to have symptoms after treatment with creams, you have a severe infection, or you have trouble fighting infections. Or if you just prefer to take a pill, an antifungal pill called fluconazole can be prescribed by your provider. What can someone do to prevent a yeast infection? The vagina will normally keep the yeast bacteria and pH of the vagina in harmony without you doing anything. Avoid perfumes, soaps, and douching in the vagina as it can interfere with this natural state of balance and increases your chance of getting an infection or irritation. When should I call my healthcare provider? Although yeast infections are the most common cause of vaginal itching and discharge, there are other causes that require different treatments and can cause more serious infections. If you have symptoms of a vaginal yeast infection like vaginal itching, increased white clumpy, or vaginal discharge, or painful red rash, you can try a vaginal cream available at most pharmacies without a prescription. If you have other symptoms like fever or pelvic or abdominal pain, you should contact your healthcare provider. If your symptoms do not improve with treatment or your symptoms return, please contact your healthcare provider as you may have a different cause of your symptoms that requires an exam, testing, or a different treatment. And as always, if you have any additional questions or concerns, please reach out to your healthcare provider.